Okay, thanks everyone. Looking forward.
Thank you. Oh. Hi everyone. A very warm welcome, morning, afternoon, and evening to you all. Thank you so much for joining us for this very exciting session titled Meaningful Progress or Empty Promises, an analysis of how gender features within NCD action plans. Before we start, I would like to acknowledge the traditional custodians of the lands we all are calling from. I pay my respects to all elders, past, present, and emerging, and extend a warm welcome to all tribes, cultures, and people represented here today. I am Deepika Saluja, part of the Impact and Engagement team at the George Institute for Global Health. And before I provide the context for the session, Inika would just be typing a couple of questions in the chat. So kindly request you to please put in your responses, mainly around two things. We want to hear from you, which part of the world you're joining in from, and which interest holder perspective you are bringing in today to the discussion. We'll have more prompts like these throughout the session to keep it engaging. So keep an eye on the chat box. Now, coming to the context of the session, non-communicable diseases cause nearly 2/3 of deaths among women worldwide, claiming around 19 million lives each year. Around the world, girls and women living with or at risk of developing NCDs experience unique challenges in accessing preventive care, early diagnosis, and treatment, particularly in low-resource settings. In recognition of the gender determinants of NCDs, countries made commitment to take a gendered approach to NCD prevention and control at the first United Nations high-level meeting on NCDs in 2011. This got reiterated and reaffirmed in the second and third high-level meeting on NCDs, respectively. And as we prepare for the fourth high-level meeting on NCDs in September 2025, the George Institute has continued its active engagement in advancing a gendered approach to NCDs. We've released our position statement emphasizing the importance of prioritizing gender within NCD responses and delivered statements on behalf of both the George Institute and the Task Force on Women and NCDs, of which we serve as the Secretariat, at the multi-stakeholder hearing in May and several other multilateral forums. Recently, we have conducted a policy-level analysis to determine how gender is or isn't integrated into the national NCD action plans. And at this event, we'll be sharing the results of this analysis and collectively explore opportunities for strengthened advocacy, particularly around integrating accountability mechanisms to support the adoption of a gendered approach to NCDs prevention and control by countries. With this brief context, I would like to invite Bhanushri and Inika, who have primarily led this analysis, to provide a brief snapshot of the findings for you. Before I hand it over to them, a very quick introduction. Bhanushri is a research assistant in the Meta Research and Evidence Synthesis Unit at the George Institute for Global Health. She holds a bachelor's degree in physiotherapy and a master's in public health from JIPMER. Her research interests are in the domain of non-communicable diseases, health equity, and health system strengthening. Inika Sharma is a research officer working at the Meta Research and Evidence Synthesis Unit at TGI. Inika has done a BA and MSc in psychology from UC Berkeley and King's College London, respectively. Her research interests include low resource mental health interventions, climate change, and equity in health. So with this brief introduction, I hand it over to you, Bhanushri and Inika.
Thank you so much, Deepika, for the warm introduction. I'll share my slides and we'll begin. Are my slides visible? Okay. Hello, everyone. I'm Hanush Soni, and I, along with Inika Sharma, will take you today to understand the results of the analysis that we conducted to understand how gender features in the integrated NCD plans. So, non-communicable diseases, as we all know, are the leading causes of death in women globally, which is responsible for nearly 2/3 of the total deaths. Why does this happen? So, girls and women experience dual disadvantage. One, they face unique exposure to the NCD risk factors, and then they also encounter systemic barriers to access the NCD care. Now, the global commitments understood it way back in 2011 and urged the nation and urged the national policy makers to pursue and promote gender-based approaches for the prevention and control of non-communicable diseases. These commitments were further reiterated in 2014 and 2018. Now, as the 2025 approaches, that is the time for fourth UNHLM meeting, we analyze this thing to understand how is gender actually considered in the integrated NCD plans. Now, to analyze this, we created a repository of all the integrated NCD plans by the existing 193 WHO member states that have been published within the last 10 years, that is 2014 onwards, and are available in English language. We located them using we hand search using keywords, combination of keywords like non-communicable diseases and chronic diseases with policy, guidance document, framework, or action plans. Second, we also look for plans on WHO NCD document repository and ICCP online resource database. Now, after having a repository, we quantified the extent of gender consideration in each plan using a derived scale that was adapted from the UNDP's Gender Result Effectiveness Scale. Now, based on their definitions and principles, we designed our own scale. This scale has different criteria to rate the extracted experts related to gender in each policy domain. The 4 domains we considered was objectives, strategies, monitoring and evaluation, and budget. Our broad classification criteria is given in the table here. It had 5 main components, that is gender negative, when a plan aggravates or reinforces gender inequalities, and goes and with the advancing level of gender integration, it goes to gender transformative, which is when a plan fosters progressive changes in power relationship between different gender by addressing the root causes of gender inequalities. Now, based on where a domain falls, we gave it a rating. Gender negative got -1, blind was 1, targeted was 2, responsive was 3, and transformative was 4. In case any domain was missing, it was given a score of 0. Now, after this, we submitted the entire score and we got the overall score. Based on the overall score, we gave the policy 1 score and its equivalent categorization. Now, to avoid any individual biases during this, all the NCD plans were reviewed by a second researcher and consensus meetings were held with a bigger team to have a final decisions on the rating. Now, I would also like to mention that this derived scale was also used to quantify the extent of integration of other 12 equity factors, including adolescent, place of residence, economic status, etc., as part of the large project. Now, I'd like to hand over to Inika to take you forward to the results of the gender analysis. Yeah, over to you, Inika.
Thank you. Hi, everyone. So going over the results, we were not able to find integrated NCD plans dated 2014 or later for 74 of the countries. For 30 countries, we did find integrated NCD plans, but they weren't available in English, so we didn't include them. So finally, our analysis includes 65 plans covering 89 countries. This included 25 of which that were covered by the consolidated EU plan. In terms of disease, majority of the plans covered diabetes, cardiovascular diseases, cancer, and respiratory diseases. And in terms of gender diseases, 75% covered breast and/or cervical cancer, 17% covered prostate cancer, and 57% covered gestational diabetes. Overall, what we found in the summatives, using the summative scores, was that majority of the countries did have targeted plans, with 22% having gender blind plans, 17% having gender responsive, and only 1 plan being categorized as gender transformative. Going through this regionally and with some examples of transformative strategies or monitoring and evaluation across the different domains. In the EU level, one of the transformative strategies used was the SERVE program, which is focused on enhancing gender equality and social fairness. The European region also starkly showed that oftentimes a lot of these integrated policies did not include budgets, which made it difficult to ascertain whether financial commitments were given with consideration to gender. In the Eastern Mediterranean region, transformative strategies included engaging and involving women through collaboration with women groups, gender equity trainings, and in terms of monitoring and evaluation, this included disaggregated data collection and reporting, as well as progress indicators, process indicators for the different transformative strategies. So as you can see in this region as well, I wanted to highlight that we've added the dates which were covered, the period covered by the plan in brackets. So a lot of these plans were not operational in 2025 or any year after. In fact, overall across regions, 49.2% of the plans did not cover 2025 or any later year. In the Americas, transformative strategies included working with women's groups to change social norms. And overall, in this region, I would like to highlight that we were only able to include 6 of the 34 countries. Most of the countries did not have an integrated NCD plan available, although 9 countries did have a plan in another language. In the Southeast Asian region, examples of transformative strategies included women empowerment programs with business incentive for healthier behaviors. Yeah. In the African region, what we found was an example of transformative strategy was a health sector plan to enhance gender equality in decision-making bodies. However, this region clearly shows that there was a lack of internal consistency across domains, and this is true in the Western Pacific region as well. So while objectives and strategy might have been responsive, this didn't always trickle across to monitoring and evaluation and the budget domains of the plan. Just to summarize, our results showed that the commitments made in the 2011 UN HLM have not translated to country-level policies. Existing plans should move towards being more responsive and transformative for gender. And this includes considering gender consistently across all different policy domains, especially monitoring and evaluation and budget. So while policies are very important to drive change, our analysis was restricted to this policy level. And it's not clear whether this is reflective of implementation success and of ground level realities. So I'll hand it over back to Deepika to take us forward so we can discuss the results in context. Thank you, everyone.
Thank you. Thank you so much, Ruchi and Nika, for providing us with such a succinct but intriguing summary of the findings. As we continue with our discussion, we would also like to hear from all of you that based on this policy analysis presented, what has been the most striking observation from the analysis for you? Please type in your response, and if you have questions on the please do share them also in the chat box. Now we move on to the next segment of the session. Management. I'd like to invite Dr. Tina
Okay, so a very good day, everyone. I am guessing and I'm hoping that Deepika was actually introducing myself and fellow panelists as well. And so it's a great pleasure to sort of take over. Deepika, apologies, you had cut out for quite a while, so I decided to step in to get us going. If you're still there, you're welcome to say a few words. Otherwise, happy to take us through the rest of the discussion.
I'm sorry for missing out, but please continue. Sorry, I wasn't trying to introduce you. I don't know how much part was audible.
No worries, and we'll get to that. And so thank you, Deepika team and the broader team at George Institute for Global Health as well. A good day to you all. I'm Shakira Shinara. I'm based at UN Women up in New York, and I have the pleasure of leading UN Women's sexual and reproductive health rights work globally. I'm joined by three wonderful and stellar panelists this morning, and they're really going to build on the findings which were presented. I believe a link to the policy brief on gender and non-communicable diseases is in the chat box, so do go and have a read as well. And as I mentioned, we're going to unpack these findings. Given that the fourth high-level meeting on non-communicable diseases is looming in a few months' time, and also the fact that we're living in unprecedented times, it's probably one of the times or one of the points in the world where we need to adopt and work towards an NCD declaration, but also navigate what action will look like in these global challenges. We also, the latest data shows us that we are off track to achieve gender equality, and we also off track to achieve Sustainable Development Goal 3. So Sustainable Development Goal 3 and 5 intersect on this very agenda. As I mentioned, I'm joined again by three stellar panelists. The first is Dr. Magda Ruballo, who needs no introduction, a well-known stalwart in our space, really. And Dr. Magda Ruballo, one of her many roles includes being the Executive Director of Women in Global Health. She's also an adjunct professor at Griffith University. Dr. Magda Ruballo also has over 30 years of experience in our space, i.e. global health, and including having served in the Ministry of Health in Guinea-Bissau. So really excited to hear from you this morning, Dr. Ruballo. We'll then turn to Dr. Catherine Karakezi. Dr. Karakezi holds several roles and is actually a pharmacist by training. Dr. Karakezi leads much efforts or many efforts on non-communicable diseases through the NCD Alliance in Kenya, through work in East Africa as well. And so Dr. Karakezi, welcome. And finally, Radhika Shirastev, who is a well-known activist and advocate in the space for non-communicable diseases. Radhika convenes and works on what's known as the NCD Alliance or Healthy India Alliance. And in addition, Radhika, I understand you have several supporting roles, including two WHO commissions. So to kick us off with really a teaser for this conversation is, in your expert opinion, Dr. Magda Ruballo, will start off with you and then shift to Radhika. So in your expert opinion, would you say that gender is integrated within the NCD agenda sufficiently, or is it glaringly missing? And if it's the latter, why would you say this is the case? So over to you, Dr. Magda.
Thank you very much, Shakira. And it is a great pleasure to be here this morning or this afternoon around a fantastic panel of experts, women on NCDs, on gender. And I think the presentation that we have just seen clearly answer your question in that gender is not sufficiently, it's actually missing from the NCD agenda. And I think the reason why gender is missing from the NCD agenda is essentially because all along the global health ecosystem has not integrated women's health fully into its programs, technical documents, guidelines, and systems as a whole. Women are still seen as reproductive health or reproductive bodies, and the overall full women's health has not been considered beyond maternal health. The broader health needs of women and girls, especially in the context of NCDs, are invisible in policy and planning, as demonstrated by your meta-analysis, which reflects a deeper issue. Gender remains sidelined in health systems, not only as a technical add-on, uh, but considered more a technical add-on rather than a structural determinant that will revolutionize and transform the overall global health ecosystem. We know that social norms and equal access to resources, lower decision-making power, and gendered exposure to risk all shape how women experience NCDs, from delayed diagnosis to inadequate care. Women in Global Health has consistently seen this across our many chapters, particularly in low resource settings where women are expected to deliver care for others, but their own health is actually undervalued and neglected. Just to give an example of community health workers, many of whom, as you know, are women, they do frontline work on NCDs like hypertension and diabetes, but they are often underpaid or unpaid, unrecognized, and excluded from formal strategies. So we believe that it is not lack of evidence, even though more research on women's health is needed. Women need to be more included into research, design, and implementation, but essentially because the systems were not built with women in mind, and we need to work towards changing that. Thank you.
Dr. Magda, a couple of keywords coming out from your intervention, which are really strong: sidelined, excluded, undervalued, and also the lack of comprehensive sort of focus and approach towards women and girls. Radhika, I'll turn to you. In your expert opinion, do you agree with Dr. Magda? Do you have anything further to add? Do you disagree? The floor is yours.
I completely, I could not disagree. She has very eloquently put forth those points. And thank you so much for this opportunity, and congratulations to the George Institute for really looking at really, critically evaluating the NCD plans from a gender lens. In addition to the points made, what I would also like to, when I was asked to sort of review the policy document and, go through the questions, the first thing that came to my mind was, who is developing the plan, right? We are looking at, doing an evaluation of these documents. Are our program planners or the policymakers who are developing these NCD action plans even aware or sensitive to the needs of women? Do they understand the complexities that Dr. Magda has spoken about? And so one of the points is also about advocates, researchers, and people with lived experience to find avenues to reach out to those policy planners and policymakers and really look at advocating for inclusion of gender, not just as a tick in the box that the word gender inclusive or gender sensitive is mentioned 2 or 3 or 4 times, but really the domains which Inika and Bhanushri have spoken about. Why can we not, make sure that it is not just words, but words which, drive action? Particularly around the domains of, say, monitoring and evaluation and fund allocation. So, once you are monitoring and evaluating or allocating funds, it will generate some sort of accountability, at least it should. And so it's really about really going back to the drawing board. Maybe give an example from India where we are in the process of renewing our national action plan, and it's just that it is so difficult sometimes to really advocate and get the right language and get the right context into the plan. So I understand the challenges, but I just think that we need to in addition to being strong advocates, we must reach out to our program planners and policymakers and make sure that lived experience is embedded in the plans.
Okay, so thank you, Radhika. You're connecting the who to the why. So why is gender missing, and it's who's really developing these plans and actions that we need to think about. To those who are listening in, and I see different stakeholders joining in from across the world, from Australia, India, Malaysia, Uganda, and all across really. The chat box, I would say, is on fire at the moment. And so feel free to continue to pop answers, questions into the chat box, specifically for our panelists. We'll take one or two key questions within this discussion. We're now going to shift to really, unpacking exactly what stood out from the findings of the policy brief from the George Institute, in which Enika and Banushree had presented. And Dr. Karikazi, if I can turn to you to take us through, what do you think are the top two findings which stand out or jump out at you, and how are they relevant for your specific context, be it Kenya, East Africa, and Africa as a whole?
So thank you very much for the question and for the invitation to join the panel. I'd just like to say, I think as my other two panelists have pointed out, the majority of countries actually are not gender responsive when it comes to NCDs. And this is despite the fact that we've had several years to get to that point. But obviously, I guess the policies that were being reviewed were probably made around the same time that the UN actually declared that these policies need to start being gender responsive. So I think that was probably the main issue that I picked up from the analysis. And yeah, so it's rather surprising. But also what also surprised me from the analysis from the Africa context, yes, there are those countries which are not gender responsive, but there have been quite a good number of countries which have actually made an attempt to at least move towards gender responsiveness. And given the fact that in Africa, we tend to be a very patriarchal society where women really have no say in most communities, depending, of course, on their cultures, it's quite interesting to see that the policymakers are actually considering having more gender responsive policies, especially for NCDs. Of course, given the understanding that women actually bear the brunt of NCDs, either as persons with lived experience, their own personal lived experience of NCDs, as caregivers, and even the fact that they in most cases don't even have their own income and are not able to make decisions about their own healthcare. So it's quite interesting to see that at least in the Africa graph, there are quite a number of countries which are actually moving towards that gender responsiveness. And I know, like in our particular situation, we do have, even if I look at our ministry and most of the policymakers are actually women. So maybe that has something to do with it, at least in our context. I don't know about the other African countries. But there are quite a good number of women going into public health and going into areas of NCDs. So maybe they are also making a shift towards that direction. And then again, just looking at the way women come together in women's groups, at least in our context, and how they do try to advocate for themselves, start small projects in terms of income generating. So I think this is also something which is having an impact in terms of the policymakers also looking and seeing how can they best address the issues of gender equity and women in NCDs. Thank you.
Dr. Karikazi, thank you. And, that also jumped out at me looking at the different African countries and the progress being made. Sure, there's challenges, but there's some progress being made. Dr. Rabalo, it would be very interesting to hear from you in terms of what are the top 2 findings and top 2 takeaways really from this newly published policy brief.
Thank you again for another very important question. I think there are 2 findings that really stand out. The first is the fact that only 1 NCD plan out of 65 reviewed is gender transformative. That's shocking, and we should definitely go to the NCD high-level meeting in New York later this year with a different kind of determination to change the status quo. This tells us that despite over a decade of global commitments, most countries are still not building equity into their policy frameworks. Gender is often mentioned in strategy documents, but there is no follow-through in monitoring or even in budgeting, which reflects this very symbolic approach rather than structural change, which is meaningful, intentional, and aligned with the overall goals that policy makers and politicians agree when they go to the UN General Assembly for these very important meetings. The second point is something that is very personal to our Women in Global Health Network, is the invisibility of women in health systems, even as they carry the burden of NCD prevention and care. For example, in countries like India, Pakistan, Kenya, our chapters have documented how female health workers provide critical NCD services, but they are often doing this work informally with little or no pay, as I said before, and without being counted in official plans, which is a missed opportunity for all of us. If we are serious about prevention, we need to invest in and recognize the women already doing the work. And we need to, most importantly, design systems that work for women's health too. And this starts from research to policy, to budgeting, to monitoring, and upholding the very same principles that are committed when these declarations are pronounced. Thank you.
Loud and clear, Dr. Rabalo, those who are invisibilized in the health system and thinking about the health workforce as well. So we've heard from Radhika on targeting the policy makers. We've heard from Dr. Karakezi on also policy making, and then Dr. Rabalo speaking about the health workforce. Of course, I think, one thing for us to also consider within this gender discussion, and of course, the evidence shows us that women and girls face the deepened inequalities that contribute to what we're seeing in terms of stigma and care, ability to hold decision-making power over their bodies and their healthcare decisions, ability to access healthcare. In sexual and reproductive health and rights, we know that we have a marker every year, which is what percentage of women are able to make decisions over their reproductive health, and it sits in the range of 44%. It would be interesting if we could have a similar marker and indicator for those living with NCDs, but also if it's holistic, as Dr. Rabalo said so at the very beginning, so comprehensively, not just on SRHR and not just on NCDs. Another element to bring into the gender discussion is those who are key and vulnerable populations. And so thinking about gender beyond the binary. And of course, as we've also seen, is the consideration of men and boys. And so gender is such a wide spectrum as we speak about it, of course, shedding the spotlight on women and girls, rightly so, but thinking about it holistically is also important. One of the key findings for me specifically, which jumped out from the policy brief, and again, thank you to the George Institute for putting this together. It's such a useful resource for us going into the high-level discussion, is the lack of gender-based budgeting and budget allocation. And I think that's such a significant finding, in addition to the fact that we don't have that many countries around the world, or not even a large number of countries around the world, who have a gender transformative policy. So we're now going to shift. It's not all doom and gloom as always. There are some best practices. If you go through the policy brief, if you looked at the slides earlier, there are some areas of green which show progress and which jump out at us. And Radhika, I'll turn to you this morning in New York at least, but I'll turn to you to share with us what are some of the best practices or positive findings or even recommendations that you take out or take away from this brief.
Yeah, thanks, Shakira. I think it's about getting our hands on the ground and trying to ensure that more of the reds and the yellow and the oranges move towards green. So it's more also in terms of identifying and also learning a lot from other health areas, I feel. For example, the NCD movement still globally is also relatively a nascent movement, right? When it as compared to other movements where gender-driven approaches have, for example, turned the tide, so to say. And so, whether it be HIV or the other communicable diseases in countries from around where I am from, I think it's also important to look at integrated approaches. It's also about not looking at NCDs as a silo, because now there are so many interlinkages between non-communicable and communicable diseases. Adopting a developmental perspective to NCDs and not really looking at it from just the perspective of NCD action plans, but broadly sustainable development plans as well. And so I think a more broader approach is required, because gender is not just a health issue, and gender is definitely not just an NCD issue.
Thanks, Radhika. I'm now going to turn to Dr. Karakazi as well on this very question. Were there any best practices or anything that stood out for you that we can take forward from this report?
Maybe just to follow up on what Radhika was saying, and just looking at the areas where there's green on the map. It is interesting to note that even in some of the Islamic nations, they do have green on the map, which is, and given the fact that they're very patriarchal and women generally tend not to have a voice, it's really interesting to see that. And just to look at the other countries where we do have areas which are green for strategy and M&E framework, which would imply that they're actually actively including gender perspective in that regard. So there is hope, I think, for the rest of the countries to move towards that direction. And also just to ensure that the momentum is sustained and we don't start backtracking. And especially as Radhika says, the need for integration of NCDs into communicable diseases and into other areas, into other sectors. And also even looking at, as was mentioned before, the area of caregiving and focusing on ensuring that women are not disadvantaged because of their primary caregivers in their countries, and how can they best be supported to carry out that role, and also to continue in their professions, because you find a lot of women and do tend to drop out of their professions to focus on caregiving and to focus on other areas of family matters. And just to ensure that even if women do have NCDs, they do get the care and support that they need. They're able to access their healthcare and able to access in terms of even just availability and transport and the finances that are required. And just to ensure that there is equity in terms of NCD healthcare, and even as we move forwards towards universal health coverage, that women are not disadvantaged just because they're women. Thank you.
Dr. Karakazi, thank you. And, also for highlighting that despite what are traditionally difficult contexts, we're still seeing gender being taken forward. So that's really, really interesting to unpack as well. I also wanted to share from the brief for those of you who have read it, and sorry, I'm going to actually read it out, but I think it's really exciting to think about, is some countries, so for example, Antigua, Barbuda, Namibia, and also St. Vincent and the Grenadine, they work with civil society, women's groups to enhance the social norms to adopt behaviors and reduce the risk of NCDs. So also within these policies and policy level action led by governments, we need to think about where and how there's space for civil society. And so some countries are showing it, and how do other countries integrate it as well. The policy brief also talks to key recommendations. So if you're an NCD advocate, which I'm guessing you are, if you're sitting on this call, and an NCD champion as well, asking you to take forward those very recommendations. I then also see a couple of questions coming through in the chat box, and keep them coming. We will get to them in a little bit. But for now, staying with you, Dr. Kerekezi, especially in your role given within the NCD Alliance in Kenya, East Africa, the different groupings that you're part of in terms of commissions on NCDs as well. How would you be taking these research findings forward?
I would say really just to advocate for meaningful inclusion of women and girls in the NCD sphere. After all, they do bear the biggest brunt, and to ensure that their voices are not heard, and that really they're invited in their own right as advocates, as persons with lived experience, either as caregivers or as people living with the conditions, really just to come and talk about the challenges and what their solutions are for what they face, and their need for them to be valued, and their experiences to actually be valued and to be taken forward, so that they're not just being invited for as a token, but essentially for them to be given a platform to advocate for themselves across the board where NCDs are concerned, whether it's caregiving or whether it's individuals living with different NCDs, and the need for them to really be valued and to be given that platform to speak for themselves, and a platform to really advocate for the women, the girls, and even for the men, because I know everybody says now that the boy child is a threatened species in our context, because everything is being focused on women and girls. But just to ensure that everybody has is able to access equity in terms of healthcare, in terms of prevention, and for their experiences to be taken forward and to be addressed in the policy making. And essentially that. And even as we move forward towards the UN high-level meeting, for us to be really clear about the areas that we really need to advocate for all these policies to be more gender transformative, and to really address the issues of NCDs across the genders, not just in women and children and girls, but in children and across, so that there is equitable access to healthcare. Yeah.
Dr. Kerekezi, thank you. And so I know that many of you are championing the role and the space of women and girls ahead of the high-level meeting, during the high-level meeting, and keeping this going and sustaining it, even expanding it, is really, really important. I'm going to turn to you, Radhika, in your role and your lead role at ReDay, but also your work with the India NCD Alliance. How do you find these, or how will you be taking these findings forward in your respective roles and work that you do?
Yeah, thanks, Shakira. So I have a specific response to that. So, like in Kenya, India has also developed recently a NCD and health equity report, which we will be releasing shortly. And we had, done this needs assessment and situational analysis, and of course, gender and women's health came out as a strong driver of equitable NCD response. So one of the things which, this is something which has inspired us, is also to talk about the policy angle in terms of how NCD plans need to be more gender transformative. And I think it's important for us as advocates to also integrate, a top-down and a bottoms-up approach where gender integration needs to be something which is cross-cutting and not just at the level of policy, but to the grassroots as well. Also, the important point that you made about looking at beyond binary. So yes, I think that is one aspect which is completely left out, right? And this is something which has also been exposed during the equity assessment that we have taken place in India. So that again is something that we look forward to making sure we get some inroads into that space. One point that I also want to make is that yes, the upcoming high-level meeting is an extremely important milestone, but I also feel that what is equally important is the dent that we make at the national level and the subnational level. And while the high-level meeting is definitely an important, say a benchmarking point, but we must continue our efforts at the national level, irrespective of what we get from out of the upcoming high-level meeting. Thanks.
Radhika, you're sort of hitting the nail on the head when it comes to thinking about gender beyond the binary as well, because we know how politicized these issues are. We know how underfunded these issues are. Yet, it's the most neglected in the healthcare systems, and every person's access to healthcare and prevention of NCDs and other diseases is critical. So, loud applause for that. I'll try and give one after the webinar, but also to jump to your point around moving beyond just the global level. And with what we're seeing, the threats to multilateralism, the threats to global cooperation, keeping the agenda on the global level is still important. But as we've seen from the policy brief as well, gender was integrated as early as 2011 in the political declarations on NCDs, and how much of progress has actually been made. And we've heard through all of you that not that much of progress. There's certain components and elements of progress, but not complete progress. And so at the global level, yes, it's one thing to have commitment and action, but it's got to translate to the national level, the local level, but importantly to patients and as we've heard from the healthcare workforce as well. I'm now going to turn to Dr. Roballo to really round up this discussion. Sure, we've spoken about unpacking the findings, how we're planning to use the findings, but in your very key and strategic role and leadership that you play in various spaces, including in Women in Global Health, how would you suggest that we work together, everyone who's listening into this call? So how do we work together ahead of the high-level meeting, keep the momentum going, make sure we have what needs to be adopted, but also beyond that as well? So over to you, Dr. Magda.
Thank you, Shakira. I think we have no option but to work together. That's the only way we can overcome the many roadblocks and challenges that we have on our way. Looking ahead to the 2025 high-level meeting in September, we must move from rhetoric to accountable action. Commitments have been made in 2011, 2014, 2018. They were strong in language. You mentioned that already in 2011 there was language around gender inclusive policies, but this has been weak in implementation, and we need to make sure that the next phase is different. So some ideas on how we can work together. I would like to offer 4 options or 4 proposals. The first one is to make sure that we center gender in national non-communicable disease action plans, not as a separate section, but as a lens that informs objectives, strategies, indicators, and budgets. Countries must report on how gender is being addressed in their non-communicable disease responses. And we need independent monitoring from civil society to be able to track that with very strong accountability mechanisms and indicators embedded into national plans. The second is for us to co-create with communities. Feminist organizations, youth groups, frontline health workers, and indigenous women must have a seat at the table, not just as stakeholders, but as co-authors of the agenda in a very genuine co-creation process. As a third way for us to work together, I would like to mention the investment in the care economy. Much of the prevention and long-term care for NCDs happens in households, in communities, and is mainly done by women. Recognizing and funding this invisible infrastructure is essential for sustainability. And then finally, let me say that we need to use these moments to unite our voices across movements, health, gender, human rights, climates. NCDs are not just a looming crisis, they are a crisis on present day. They are not just a health crisis, they are a social justice crisis. And we need to make sure that the fourth high-level meeting on NCDs, it's not just a milestone for us to tap ourselves in the back and said we made it. It's a turning point and an opportunity for us to do things differently. So I hope these are interesting ways of working together for you to consider and then see how we can join forces to move forward. Thank you.
Dr. Rabello, thank you. And, it's also thinking about how do we take the NCD agenda again forward. We started the discussion saying that it's extremely difficult a difficult context. We're seeing the disintegration of global health as we know it. We're seeing countries struggling health systems wise. And so taking this forward is going to be even more difficult and more challenging. But I do believe that working together, we up for the fight ahead, no doubt. So we're about to end off. There is one interesting question which has come through. I'm going to read it out. It's quite a long one, but it does focus on Africa. So Dr. Rabello or Dr. Karekezi, one of you can answer, or both of you. Good to hear from you. So the question comes from Zaniziwa, I believe, who says that countries were expected to submit NCD 3.0 and the deadline has passed, with less than 1% of African countries having made their submission. What do you think about the current process where consultations are very closed and also countries not to be friendly to inclusive participation? What do you think women groups can do to dismantle these barriers? So it's quite a big question. It's really linked to the NCD 3.0, the fact that the deadline has passed, talking about accountability. Only 1% of African countries have made their submission. And how do we make sure that we get the issues that we have on the agenda, but also the engagement? So either to you, Dr. Rabello, or Dr. Karekezi. I see you're unmuted, Dr. Rabello, so I'm guessing perhaps you want to go first, and then we'll turn to you, Dr. Karekezi.
I wanted to defer to my sister, Dr. Karekezi, but this poor outcome, only 1% of African countries submitting their contributions, is a testimony of the amount of work we have ahead of us. We should increase and step up our advocacy, awareness raising, but also work with the countries, in countries, so that they don't miss the deadlines or they don't deprioritize something as urgent, as important as this one. I'm sure my sister will have also other elements to add. Thank you, Shakira.
So thank you for the question. And I think, as Dr. Rabello has said, yes, we do often tend to miss these deadlines. And I think we do need to be more proactive in ensuring that we keep up to date with what is going around. I know some of these do tend to be closed or in terms of their circulation, but not all. But I think we just need to be more, basically more proactive, keeping our eyes and ears open and having a broader network which can alert us as to what is actually happening in the world beyond our boundaries, so that we don't miss such important deadlines to make a difference or to make our submissions, which can really make a difference in our own countries and around the African continent. Yeah, thank you.
And we often miss deadlines. I don't know if we need to definitely advocate around that and make sure that there's timely reporting, for example, and what's the implications of this as well, and what's the level of prioritization as well for reporting. I'm going to bring you back into the conversation briefly, Inika and Banishri. So there's been a lot of questions around methodology of the policy brief. There's been lots of questions about data. I'd like to give you 2 minutes to respond each to some of the questions. So sorry for the tight timeline, but over to you, Inika, first, and then Banishri as well, if there's anything you would like to respond to.
Yeah, I think just to reiterate, I think some of the questions in the chat have been really interesting. We were limited in our current analysis to English policies, but we are looking to see how we can include policies in Spanish, French, Portuguese to begin with, as well as other languages. And I do want to reiterate also that we're planning to release a larger paper that looks at 13 different equity parameters and how intersectionality is considered within these integrated NCD policies. So that would go beyond just gender to see how adolescents are considered, migrants are considered, low socioeconomic status groups, LGBTQ plus groups, etc. So yeah, that's what we have planned. And just really quick, in terms of methodology, we did adapt our scale from the UN DP gender results effectiveness scale. And we adapted that for the different sections so that we could come up with a summative score. And yeah, if you're interested in more details, you can also see the policy brief that we've linked online. Banishri, yeah, please go ahead.
Yeah, thank you, Rika. I'll just add a little bit more on the methods. So what our base was the UNDP GRES, but then we derived a very extensive scale to have an objectivity in how we are rating the different scales, different domains that have been represented in the policy, that is objectives, strategies, monitoring and evaluation, and the budget section. Whether we want to rate it as gender blind, gender targeted, responsive, or transformative, we have a very extensive scale to induce the objectivity in it. I think that will also come out along with the extensive paper that will. Thank you.
Banishri and Inika, thank you, and exciting to hear that more research and more data is coming out. It's definitely needed. That's a neglected area as well. And we could possibly have a whole discussion on the scale, its usefulness, how you unpack it, and how we utilize it, where it could be improved, what are the gaps. So I see a lot of questions coming through on that. Thank you to the audience for listening in. It's been great to be able to unpack the George Institute policy brief with you. I do want to give one of the fellow panelists a final word. Radhika, if you were to really have a call to action, let's say 2 top calls to action that you want everyone to go away with from this webinar, what would it be?
Start working from a gender-oriented approach. Many of you may not be working on gender. We all need to do this. It's not just for the governments. And the second would be not to oversimplify gender, because there are, even if you just talk about women, there are cross-sectional issues, intersectionalities where not all women also are at par. So looking at the most vulnerable even among the women.
So there you have it. You've got a link to the George Institute policy brief, which is out. Do have a look. Further findings and more exciting research is loading as well, I understand, and we understand. We were joined by Dr. Magda Ruballo, Radhika Shuristav, and Dr. Catherine Karakezi. Thank you for helping us unpack these briefs, for helping us think through what we need to do ahead of the high-level meeting beyond the type of collaboration that we need. I did see in the chat box, there was a comment about us all being female and point taken. taken. But as we say in South Africa, womandla, and so women equals power. By no means have we meant to neglect anyone. We certainly try to bring men into this discussion as well. Again, point taken, but let's leave off on the note of womandla, given the high levels of inequalities that underpin what women and girls go through, and this underpins the burden of non-communicable diseases, but also global health in general. And so as we move towards the high-level meeting, I have no doubt, thanks to strong advocates like yourself, we will see NCDs and gender being placed high on the agenda, but a lot of work for us to roll up our sleeves and take this forward. It's been a pleasure to have moderated this discussion and been with you. I'd now like to hand over back to Deepika.
Thank you. Thank you so much, Shakira, and thank you so much to all the panelists, Dr. Magda Raballo, Dr. Catherine Garkesi, Radhika Srivastava, and also Inika and Bhanushree, for such an insightful panel discussion. You know, this conversation brought out a range of perspectives on why gender and equity-based approach needs to be integrated, must be integrated within the NCD agenda. Also asking some very critical questions like who's developing these plans, and if you're serious about integrating gender, we need to work at the systems level, while also sharing very interesting reflections and observations on the analysis and best practices, such as like why or if we are seeing green areas in Islamic countries with limited agency for women, what lessons does it offer for us? We're especially grateful for the concrete actions that you all have shared in terms of, that highlight that how these important findings can be translated into our work, research, and advocacy for the fourth high-level meeting and beyond. And as we continue to demand accountability, to see these commitments getting implemented and delivered on the ground in our respective regional, country, and local settings. As we move forward and engage with the stakeholders to make sense of these findings, we invite you all to join us in strengthening collective advocacy for a gendered responsive approach to NCDs, joining in for the Task Force for Women and NCDs that the George Institute hosts is one of the ways to explore joint advocacy and other opportunities to work together. And I've dropped the email ID. If you have any queries or interest in joining, please write us an email. And yes, a big thank you to all for making this session such an interesting unpacking dialogue, leaving us with a lot of thoughts and questions and steps to take it forward as we continue to engage. Please share the policy brief widely and continue to engage in dialogues. As Bhanushree and Inika mentioned, that the full project unpacks 13 equity factors and intersectionality within these NCD action plans, which will be published as a full paper, and we'll share that out. So please keep an eye out. And with that, many thanks once again. Stay tuned for the next steps and have a good day, afternoon, evening, from different locations that you're joining in. Thank you so much.
Thank you. Bye-bye.
Thank you. Bye-bye.
Thanks. Bye, everyone.
Bye.